Good morning, friends, brothers, and sisters. It's Dr. Karan from DrPKlyfe. Today I'm going to talk about BPH, benign prostatic hyperplasia, enlarged prostate. The BPH stands for benign prostatic hyperplasia. It's non-cancerous growth of the prostate gland, which surrounds your urethra, the tube you pee through. As the prostate gets bigger, it squeezes the urethra, causing symptoms like frequent urination, especially at night, difficulty starting urine, weak stream, incomplete bladder emptying, and dribbling after urination. Over 50% of men over age 50 have BPH, and by 80, it's over 80% of men. What causes BPH? The exact cause is not fully known, but leading theory is hormonal changes with age, higher levels of DHT, dihydrotestosterone, imbalance of estrogen and testosterone, chronic inflammation, genetics, obesity, and poor diet can increase your risk. So what are the treatment options? Medications, alpha blockers like tamsulosin or Flomax, relax prostate muscles, 5-alpha reductase inhibitors like finasteride or Proscar, shrink prostate, PDE5 inhibitors like tadalafil can help both BPH and ED. Surgery like TURP, roto-rooter, transurethral resection of prostate, or laser ablation can also help if your symptoms are severe. Natural support options. Saw palmetto blocks DHT activity, so it prevents prostate from getting bigger further. Nettle root is anti-inflammatory. Lots of patients with the BPH has chronic inflammation bladder. It helps quite a bit. Pumpkin seed oil is rich in zinc and helps inflammation. Pygium africanum improves urine flow and reduces nighttime urination. And cranberry and D-mannose, they're all for bladder support. And DrPKlyfe has a product with all these components, so you can check it out, drpklyfe.com. Always consult a doctor before starting any supplements, especially you are on medication, because of risk of interaction. So let's talk about the PSA. Prostate-specific antigen test is a protein made by prostate. It can be high if there's a prostate cancer or BPH or prostatitis or recent ejaculation or recent distal rectal examination. Total PSA means all PSA in the blood. Free PSA means the unbound form of PSA in the blood. Why do we care? Prostate cancer tends to be lower. Prostate cancer tends to have a lower free PSA, while BPH, you have higher free PSA. So the rough numbers are like this. If total free PSA is more than 25%, there's a low cancer risk. Most likely it's BPH. If free PSA level is in between 10 to 25%, it's gray zone. If percentage of free PSA is less than 10%, there's a high cancer risk. So biopsy can be considered. PSA trend is very important. Rising quickly or doubling fast are more concerning than a single number, and that could indicate impending cancer. Who should get PSA screening done? Age 50, that's regular PSA check is needed. Age 45 plus, if African American or family history of prostate cancer. Earlier, if you have prostate symptoms. Lifestyle tips for prostate health. Eat more tomatoes, lycopene in it helps. Green tea, flax seeds, cruciferous veggies. Avoid high fat meat, dairy, and processed sugar. Exercise every day, hydrate yourself, manage stress. So if you are experiencing symptoms or your PSA is rising, don't ignore it. BPH is treatable and prostate cancer is curable if caught early. Knowing your PSA levels, tracking your symptoms, and making the right lifestyle changes and treatment choices can make all the difference. So check out DrPKlyfe's Herbal Prostate Support Formula. It's formulated by me and research backed. You can check out at www.drpklyfe.com. That is drpklyfe.com. Like, comment, and follow for more men's health related videos. Thank you for watching.